Welcome, gentlemen. It's wonderful to have you here today. Whether you're tuning in for the first time or you're a loyal viewer, I want you to know how much I appreciate your presence. Your dedication to your health and well-being is truly admirable, and I'm honored to be a part of your journey towards a happier, healthier life. Today, we're diving into a topic that's close to my heart and crucial for every man over 60, male health in maturity. Now, I know what some of you might be thinking. Oh no, not another lecture about getting old. But I promise you, this isn't about dwelling on the negatives. Instead, we're going to explore the natural changes that come with age, understand them, and most importantly, learn how to thrive despite, or even because of, these changes. Let's start by acknowledging something important. It's completely normal to have concerns or questions about your body as you age. In fact, it's a sign of self-awareness and a proactive approach to health. So, if you've been wondering about certain changes or have felt hesitant to discuss them, I want you to know that you're not alone. Millions of men worldwide are experiencing similar changes, and today we're going to address them head-on. In the next hour or so, we'll cover a range of topics that are essential for maintaining and improving your health as a mature man. We'll talk about everything from the natural changes in your body to practical tips for staying vibrant and active. You'll learn about urinary health, sexual function, proper hygiene, exercise, nutrition, and so much more. But more than just providing information, I want to empower you with knowledge and strategies that you can apply in your daily life. Now, let's begin our journey by exploring the natural changes that occur in the male body as we age. It's important to understand that aging is not a disease. It's a natural process that every living being goes through. However, understanding these changes can help us adapt and respond in ways that enhance our quality of life. As men age, several structural and functional changes occur in the body. You might notice that your skin becomes less elastic, your muscle mass decreases slightly, and perhaps you're not as flexible as you once were. These changes are part of the normal aging process and are influenced by factors like genetics, lifestyle, and overall health. One area where men often notice changes is in their reproductive system. The prostate gland, for instance, tends to enlarge with age. This is known as benign prostatic hyperplasia, BPH, and can affect urinary function. You might find that you need to urinate more frequently, especially at night, or that your urine stream isn't as strong as it used to be. While these changes can be frustrating, they're usually not serious and can be managed effectively with the right approach. Another common change is in sexual function. Many men experience a gradual decrease in testosterone levels as they age, which can affect libido and sexual performance. You might find that it takes longer to achieve an erection, or that your erections aren't as firm as they once were. These changes are normal and don't mean the end of your sex life. Far from it. With the right mindset and sometimes a little medical help, many men continue to enjoy fulfilling sex lives well into their golden years. It's crucial to remember that these changes don't define you. They're simply part of the journey of life, and with the right attitude and care, you can continue to lead an active, satisfying life. In fact, many men find that with age comes a new appreciation for their bodies and what they're capable of. Now, I know that these changes can sometimes affect your emotional well-being. It's not uncommon to feel a bit anxious or even depressed when you notice your body changing. You might worry about what these changes mean for your masculinity or your relationships. These feelings are valid, and it's important to acknowledge them. However, it's equally important not to let them overwhelm you. One of the best ways to cope with these changes is to focus on what you can control. This includes maintaining a healthy lifestyle, staying active, eating well, and keeping your mind engaged. It also means being proactive about your health. Regular checkups, open communication with your healthcare provider, and a willingness to address issues as they arise can make a world of difference. Another crucial aspect of dealing with these changes is maintaining a positive outlook. Yes, your body is changing, but you're also gaining wisdom, experience, and hopefully, a deeper appreciation for life. Many men find that their 60s and beyond are some of the most fulfilling years of their lives. You have the opportunity to redefine what masculinity and vitality mean to you on your own terms. Let's talk about some practical tips for adapting to these changes. First and foremost, listen to your body. If something doesn't feel right or you notice a sudden change, don't hesitate to consult with your doctor. Early detection and treatment of any issues can make a significant difference in your overall health and quality of life. Staying physically active is crucial. Regular exercise not only helps maintain muscle mass and bone density, but also improves cardiovascular health, boosts mood, and can even enhance cognitive function. You don't need to run marathons or lift heavy weights. Gentle, consistent activity like walking, swimming, or Tai Chi can be incredibly beneficial. Nutrition plays a vital role in how we age. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains can help support your body's changing needs. Staying hydrated is also crucial. Many of the changes we associate with aging, like dry skin or constipation, can be alleviated simply by drinking enough water. Don't underestimate the power of social connections. Maintaining strong relationships with friends and family, or forming new connections through community activities or hobbies, can have a profound impact on your mental and emotional well-being. Engaging in activities that stimulate your mind, like reading, puzzles, or learning a new skill, can help keep your brain sharp and give you a sense of purpose and accomplishment. Lastly, be kind to yourself. Aging is a privilege denied to many, and each day is an opportunity to live fully and joyfully. Embrace the changes, celebrate your journey, and remember that you have so much to offer the world, regardless of your age. As we move forward in our discussion, we'll delve deeper into specific aspects of male health and maturity. We'll explore ways to maintain urinary and prostate health, strategies for maintaining sexual vitality, the importance of proper hygiene and self-care, and much more. Remember, knowledge is power, and by understanding your body and its needs, you're taking an important step towards a healthier, happier you. Now, let's turn our attention to a topic that's crucial for every man's health but often overlooked: urinary and prostate health. As we age, changes in these areas become more common, and understanding them is key to maintaining your overall well-being. Let's start with urinary health. Have you ever noticed your urine looking foamy or bubbly? This can be a cause for concern for many men. While sometimes it's simply due to the force of urination hitting the toilet water, persistent, foamy urine could indicate the presence of protein in your urine, a condition known as proteinuria. This could be a sign of kidney issues, so it's important not to ignore it. But don't panic just yet. There are many reasons why this might happen, and not all of them are serious. For instance, temporary proteinuria can occur after intense exercise or during a fever. However, if you notice foamy urine consistently, it's wise to consult with your doctor. They may recommend a simple urine test to check for protein levels and assess your kidney function. Another common urinary change many men experience is an increased frequency of urination, especially at night. This condition, known as nocturia, can be frustrating and impact your sleep quality. It's often related to an enlarged prostate, a common condition in older men known as benign prostatic hyperplasia, BPH. BPH is not cancer and doesn't increase your risk of prostate cancer, but it can certainly affect your quality of life. Besides frequent urination, symptoms may include a weak urine stream, difficulty starting urination, or feeling like you haven't completely emptied your bladder. If you're experiencing these symptoms, it's important to discuss them with your doctor. There are many effective treatments available, from lifestyle changes to medications and, in some cases, minimally invasive procedures. Now, let's talk about prostate health. The prostate is a small gland that plays a big role in male reproductive health. As we age, it's common for the prostate to enlarge, which can lead to the urinary symptoms we just discussed. But there's another aspect of prostate health that's crucial to discuss: prostate cancer screening. Prostate cancer is one of the most common cancers in men, especially as we age. The good news is that when caught early, it's often treatable. This is why regular checkups and screenings are so important. The American Cancer Society recommends that men at average risk should have a discussion with their doctor about screening starting at age 50. However, if you have a family history of prostate cancer or are African American, you might need to start this conversation earlier, around age 45. The most common screening test for prostate cancer is the PSA, prostate-specific antigen, blood test, often combined with a digital rectal exam. Now, I know the idea of these tests can make some men uncomfortable, but remember, a moment of discomfort is a small price to pay for peace of mind and potentially life-saving early detection. Let's move on to some practical tips for maintaining good urinary and prostate health. First and foremost, stay hydrated. Drinking plenty of water helps flush out your urinary system and can prevent urinary tract infections. Aim for about 8 glasses of water a day, but listen to your body. Your needs may vary based on your activity level and climate. Watch your diet too. Some foods and drinks can irritate your bladder and make urinary symptoms worse. Common culprits include caffeine, alcohol, artificial sweeteners, and spicy foods. If you're having urinary issues, try cutting back on these and see if it makes a difference. Regular exercise is also beneficial for urinary and prostate health. It can help maintain a healthy weight, which is important because obesity has been linked to an increased risk of urinary problems and more severe BPH symptoms. Aim for at least 30 minutes of moderate exercise most days of the week. This could be as simple as a brisk walk or a swim. Kegel exercises aren't just for women. They can be beneficial for men too, especially if you're dealing with urinary incontinence. These exercises strengthen the pelvic floor muscles, which support the bladder and help control urination. Do a Kegel. Simply tighten the muscles you would use to stop urinating midstream. Hold for a few seconds, then release. Aim to do a few sets of 10 repetitions each day. If you're a smoker, here's another reason to quit. Smoking has been linked to an increased risk of urinary problems and more severe BPH symptoms. It's also a risk factor for bladder cancer. If you need help quitting, talk to your doctor about smoking cessation programs or medications that might help. Now, let's address an important but often overlooked aspect of urinary health: bathroom habits. When you use the restroom, take your time. Don't rush, and make sure you're emptying your bladder completely. If you feel like you need to go again soon after urinating, it might be worth waiting a few minutes to see if you can empty your bladder more fully. For those of you dealing with nocturia, frequent nighttime urination, try limiting your fluid intake in the evening, especially within 2 hours of bedtime. However, don't restrict your overall fluid intake. Remember, staying hydrated is important. Instead, try to drink more of your daily fluids earlier in the day. It's also worth mentioning the importance of hygiene. Always wipe from front to back to prevent bacteria from the rectum from entering the urethra. If you're uncircumcised, be sure to clean under the foreskin regularly to prevent infections. Let's talk about stress for a moment. You might be surprised to learn that stress can affect your urinary health. When you're stressed, your pelvic floor muscles can become tense, which can lead to urinary urgency or frequency. Practicing stress reduction, techniques like deep breathing, meditation, or yoga can be helpful not just for your overall well-being, but for your urinary health too. Now, I want to emphasize something important. While all these self-care measures are valuable, they're not a substitute for regular medical checkups. As men, we sometimes have a tendency to avoid the doctor unless something is seriously wrong. But when it comes to urinary and prostate health, prevention and early detection are key. Make sure you're getting regular checkups with your doctor. During these visits, be open about any symptoms or changes you've noticed, even if they seem minor or embarrassing. Remember, your doctor has heard it all before, and no concern is too small or too awkward to discuss when it comes to your health. If you're over 50, or younger if you're at higher risk, talk to your doctor about prostate cancer screening. Discuss the potential benefits and risks of screening to make an informed decision that's right for you. Lastly, I want to touch on the emotional aspect of dealing with urinary or prostate issues. These problems can be frustrating and may impact your quality of life. They might make you feel embarrassed or affect your self-esteem. It's important to acknowledge these feelings and know that it's okay to feel this way, but also remember that you're not alone, and there's no need to suffer in silence. There are many treatment options available, and with the right care, most urinary and prostate issues can be effectively managed. Now let's address a topic that's often on men's minds but not always openly discussed: sexual health and function. As we age, it's natural to experience some changes in this area, but it's important to understand that these changes don't have to signal the end of a satisfying sex life. With the right approach, many men continue to enjoy fulfilling sexual relationships well into their later years. One of the most common concerns for men as they age is erectile dysfunction, ED. This condition, characterized by difficulty achieving or maintaining an erection sufficient for sexual intercourse, becomes more prevalent as we get older. It's estimated that about 40% of men are affected by ED at age 40, and nearly 70% by age 70. However, it's crucial to understand that ED is not an inevitable part of aging, and in many cases, it can be successfully treated. There are various causes of erectile dysfunction. Sometimes, it's related to underlying health conditions such as diabetes, heart disease, or high blood pressure. In other cases, it may be a side effect of certain medications. Lifestyle factors like smoking, excessive alcohol consumption, obesity, and lack of physical activity can also contribute to ED. And let's not forget about psychological factors. Stress, anxiety, depression, and relationship issues can all play a role in sexual function. If you're experiencing persistent difficulties with erections, the first step is to consult with your doctor. They can help determine the underlying cause and recommend appropriate treatments. These might include lifestyle changes, medications like PDE5 inhibitors, such as Viagra or Cialis, or in some cases, more specialized treatments like injection therapy or vacuum devices. It's important to note that ED can sometimes be an early warning sign of more serious health issues, particularly cardiovascular disease. This is because the blood vessels in the penis are smaller than those in the heart, so problems may show up there first. This is another reason why it's crucial to discuss any sexual health concerns with your doctor. But erectile function is just one aspect of male sexual health. Many men also experience changes in libido or sex drive as they age. This is often related to declining testosterone levels, a natural part of aging for men. However, a low libido can also be a symptom of other health issues or a side effect of certain medications. If you're concerned about your libido, again, the best course of action is to speak with your doctor. They can check your testosterone levels and look for any other underlying causes. In some cases, testosterone replacement therapy might be recommended, but this is a decision that should be made carefully, weighing the potential benefits against the risks. Another common change men may notice is a longer refractory period. That's the time needed between ejaculations before being able to achieve another erection. This is a normal part of aging and not usually a cause for concern. It simply means you might need more time between sexual encounters, which can actually lead to a more relaxed and enjoyable experience. Now let's talk about some practical strategies for maintaining sexual health as you age. First and foremost, maintain a healthy lifestyle. Regular exercise, a balanced diet, and avoiding harmful habits like smoking can all contribute to better sexual function. Exercise, in particular, is crucial. It improves cardiovascular health, boosts energy levels, and can even increase testosterone production. Don't underestimate the importance of overall physical affection and intimacy. As we age, we might need to expand our definition of sex beyond just intercourse. Touching, kissing, and other forms of physical intimacy can be deeply satisfying and help maintain a strong emotional connection with your partner. Communication is key when it comes to sex at any age, but it becomes even more important as we get older and our bodies change. Be open with your partner about your needs, desires, and any concerns you might have. Remember, they may be experiencing changes too, and honest communication can help you both adapt and continue to enjoy a fulfilling sex life. It's also worth mentioning the importance of safe sex practices. Even if pregnancy is no longer a concern, sexually transmitted infections, STIs, can affect people of all ages. If you're sexually active with new or multiple partners, make sure to use protection and get regular STI screenings. Now, let's address an often overlooked aspect of sexual health: pelvic floor exercises. We mentioned Kegels earlier in relation to urinary health, but they can also be beneficial for sexual function. Strong pelvic floor muscles can help with erectile function and ejaculatory control. To do a Kegel, simply contract the muscles you would use to stop urinating midstream. Hold for a few seconds, then release. Aim for a few sets of 10 repetitions each day. Mental health plays a crucial role in sexual function too. Stress, anxiety, and depression can all impact libido and sexual performance. If you're struggling with these issues, don't hesitate to seek help. Talking to a therapist or counselor can be incredibly beneficial, not just for your mental health, but for your sexual well-being too. For those in long-term relationships, it's important to keep the spark alive. This might mean setting aside dedicated time for intimacy, trying new things in the bedroom, or even seeking the help of a sex therapist if you're struggling to connect sexually. Remember, it's never too late to explore and experiment in your sex life. Let's also talk about the impact of certain health conditions on sexual function. Chronic diseases like diabetes, heart disease, and prostate cancer can all affect sexual health. If you're managing one of these conditions, make sure to discuss any sexual concerns with your healthcare provider. There may be treatments or strategies available to help you maintain a satisfying sex life while managing your condition. Medications can also impact sexual function. Many common drugs, including some antidepressants, blood pressure medications, and prostate cancer treatments, can affect libido or cause erectile dysfunction. If you suspect a medication might be impacting your sexual health, talk to your doctor. Never stop taking a prescribed medication without consulting your healthcare provider first, but they may be able to adjust your dosage or switch you to an alternative that has fewer sexual side effects. It's also worth mentioning that there are many myths and misconceptions about sex and aging. One common myth is that older adults are no longer interested in sex. This simply isn't true. Many people continue to enjoy active sex lives well into their 70s, 80s, and beyond. Another myth is that sexual problems are an inevitable part of aging. While changes are normal, severe sexual dysfunction is not a normal part of aging and can often be treated. Lastly, I want to emphasize the importance of a positive attitude. Your mindset can have a significant impact on your sexual health. Embrace the changes that come with age, focus on the positives, and remember that sex can be enjoyable at any age. With open communication, a willingness to adapt, and a positive outlook, many couples find that their sex lives actually improve as they get older. Remember, there's no shame in seeking help for sexual health issues. Whether it's talking to your doctor, seeing a therapist, or exploring treatment options, taking action to address your concerns is a sign of strength, not weakness. You deserve to have a satisfying and healthy sex life at any age. Let's focus now on two crucial aspects of men's health that often don't get enough attention: proper hygiene and physical activity. These fundamental elements of self-care become increasingly important as we age, and getting them right can make a significant difference in your overall health and well-being. First, let's talk about proper hygiene practices. As we age, our skin becomes more sensitive and prone to irritation, making proper cleaning and care even more crucial. Many men might think they've been washing themselves correctly their whole lives, but there are specific considerations to keep in mind as we get older. When it comes to intimate hygiene, it's essential to clean thoroughly, but gently. Use warm, not hot water, and mild, unscented soap specifically designed for sensitive areas. Harsh soaps or body washes with strong fragrances can irritate the skin and disrupt the natural pH balance. Pay special attention to all areas, including under the foreskin if you're uncircumcised, but avoid aggressive scrubbing which can cause irritation. After washing, it's crucial to dry thoroughly but gently. Moisture trapped in skin folds can lead to fungal infections, which become more common as we age. Use a clean, soft towel and pat dry rather than rubbing. Pay particular attention to the groin area, as fungal infections like jock itch thrive in warm, moist environments. Change your underwear daily and choose breathable fabrics like cotton. Tight-fitting synthetic materials can trap moisture and heat, creating an environment where bacteria and fungi can flourish. If you're active or tend to sweat a lot, you might want to change your underwear more frequently or consider moisture-wicking underwear designed for active wear. Now, let's transition to physical activity, which is absolutely vital for maintaining health and vitality as we age. Regular exercise offers numerous benefits, from improving cardiovascular health and maintaining muscle mass to boosting mood and cognitive function. However, it's important to approach exercise appropriately and safely at this stage of life. Before starting any new exercise routine, it's wise to consult with your healthcare provider, especially if you have any chronic conditions or haven't been active for a while. They can help you determine what types of exercise are safe and appropriate for your fitness level and health status. Walking is one of the best exercises for older adults. It's low impact, requires no special equipment other than good shoes, and can be done almost anywhere. Start with short walks of 10 to 15 minutes and gradually increase both duration and pace as your fitness improves. Aim for at least 30 minutes of walking most days of the week. Strength training is another crucial component of fitness for older men. As we age, we naturally lose muscle mass through a process called sarcopenia. Regular strength training can help slow this loss and even build new muscle tissue. You don't need to lift heavy weights or use complicated equipment. Bodyweight exercises, resistance bands, or light dumbbells can be very effective. Focus on exercises that target major muscle groups. Simple exercises like wall push-ups, chair, squats, and standing leg raises are great starting points. Start with one set of 8 to 10 repetitions and gradually increase as you get stronger. Remember to breathe steadily throughout each exercise and never sacrifice form for speed or weight. Balance exercises are particularly important as we age since good balance helps prevent falls. Simple exercises like standing on one foot, holding onto a chair for support if needed. Heel-to-toe walks, or Tai Chi, can help improve balance. These exercises can be incorporated into your daily routine. Try practicing balance while brushing your teeth or waiting in line. Flexibility exercises help maintain range of motion and prevent stiffness. Gentle stretching exercises should be done after warming up or at the end of your workout when muscles are warm. Hold each stretch for 15 to 30 seconds without bouncing, and never stretch to the point of pain. Swimming or water exercises can be excellent options for older adults, especially if you have joint problems or arthritis. The water provides natural resistance while supporting your body weight, making it easier on your joints. Many community pools offer water aerobics classes specifically designed for seniors. Remember to stay well hydrated during exercise, especially in warm weather. Drink water before, during, and after physical activity. Watch for signs of overexertion like excessive shortness of breath, chest pain, or dizziness. If you experience any of these symptoms, stop exercising and seek medical attention if necessary. As you become more active, you might notice changes in your hygiene needs. You may need to shower more frequently or use different products to prevent skin irritation from sweat. Consider using an antiperspirant specifically designed for active adults, and always change out of sweaty clothes promptly after exercise. It's also important to pay attention to your feet as you increase your activity level. Wear properly fitting shoes with good support, and inspect your feet regularly for any signs of blisters, cuts, or other problems. This is especially important if you have diabetes or circulation problems. Listen to your body and adjust your activity level accordingly. Some days you might feel more energetic than others, and that's perfectly normal. The key is consistency, over intensity. Regular, moderate exercise is more beneficial than occasional intense workouts. Remember that exercise isn't just about physical health, it's also great for mental well-being. Regular physical activity can help reduce stress, improve sleep quality, and boost mood. Many men find that joining exercise classes or walking groups provides valuable social interaction as well as physical benefits. Let's conclude our discussion by focusing on nutrition, mental well-being, and the importance of regular medical checkups. 3 crucial elements that tie everything we've discussed together. Remember, maintaining good health as we age requires a holistic approach that addresses both physical and emotional needs. When it comes to nutrition, your dietary needs may change as you get older. Your metabolism naturally slows down, which means you might need fewer calories than before. However, the need for nutrients remains just as important, if not more so. Focus on nutrient-dense foods rather than empty calories. Include plenty of lean proteins, which are essential for maintaining muscle mass. Good sources include fish, lean meats, eggs, and legumes. Fruits and vegetables should make up a significant portion of your diet. They're packed with antioxidants that help fight inflammation and support overall health. Aim for a variety of colors. Each color represents different beneficial compounds. Dark leafy greens are particularly important as they're rich in vitamins and minerals that support bone health. Don't forget about healthy fats, especially omega-3 fatty acids found in fatty fish like salmon, mackerel, and sardines. These fats are crucial for brain health and can help reduce inflammation throughout the body. If you don't eat fish regularly, talk to your doctor about whether a fish oil supplement might be beneficial. Fiber becomes increasingly important as we age. It helps maintain digestive health, controls blood sugar levels, and can help manage cholesterol. Good sources include whole grains, legumes, fruits, and vegetables. Aim for 25-30 grams of fiber per day, but increase your intake gradually to avoid digestive discomfort. Staying hydrated is crucial but often overlooked. As we age, our sense of thirst may decrease, making it easier to become dehydrated. Make a habit of drinking water throughout the day, even if you don't feel thirsty. Keep a water bottle nearby as a reminder, and limit alcohol and caffeine, which can contribute to dehydration. Now, let's address mental well-being, which is just as important as physical health. Many men struggle with emotional issues as they age, particularly around retirement, changing roles, and physical changes. It's crucial to understand that seeking help for mental health concerns is not a sign of weakness. It's a sign of wisdom and self-care. Stay socially connected. Isolation can lead to depression and cognitive decline. Join community groups, maintain friendships, and make an effort to stay in touch with family. Consider volunteering. It's a great way to stay active, meet new people, and maintain a sense of purpose. Keep your mind active through activities like reading, puzzles, learning a new language, or taking up a new hobby. These activities can help maintain cognitive function and provide enjoyment. Remember, it's never too late to learn something new. Regular medical checkups become increasingly important as we age. Work with your healthcare provider to develop a screening schedule appropriate for your age and risk factors. This typically includes regular blood pressure checks, cholesterol screening, diabetes screening, and cancer screenings. Don't wait for problems to become severe before seeking medical attention. Many conditions are more easily treated when caught early. Be honest with your healthcare provider about any concerns or changes you've noticed, no matter how minor they may. might seem. Keep track of your medications and supplements, including over-the-counter products. Bring a complete list to all medical appointments, and don't hesitate to ask questions about potential interactions or side effects. I want to emphasize something that's been woven throughout our discussion. Aging is not a disease. It's a natural process that, with the right approach, can be a rich and rewarding phase of life. The key is to be proactive about your health while maintaining a positive attitude. Remember that you're not alone on this journey. There are many resources available to help you maintain your health and well-being as you age. Don't hesitate to reach out to healthcare providers, support groups, or community organizations for assistance when needed. If you've found this information helpful, I encourage you to subscribe to our channel. By joining our community, you'll have access to regular updates and more detailed discussions about maintaining health and vitality as you age. Your engagement helps us create more content tailored to your needs and interests. In closing, I want to remind you that taking care of your health is one of the most important investments you can make. Every small step you take toward better health, whether it's going for a walk, choosing nutritious foods, or scheduling that checkup you've been putting off, adds up to significant benefits over time. Thank you for joining me today. Remember, age is just a number. It's how you live your life that truly matters. Stay active, stay positive, and most importantly, stay committed to your health and well-being. Until next time, take care of yourself, and don't forget to subscribe for more valuable health information tailored specifically for men in their golden years.